URMC workers and state lawmakers sound the alarm about the condition of our healthcare system one day after the governor announced a budget agreement. As Alex Love reports, those who attended a rally today say more healthcare funding is needed.
In efforts to open up more bed space in hospitals and nursing homes while growing staff numbers, URMC healthcare workers and state lawmakers of the greater Rochester area demand this year's state budget include more funding to the Medicaid reimbursement rate to amounts it hasn't seen in more than a decade.
Healthcare in our region is in crisis.
Right now in New York, healthcare providers are reimbursed an average of 61 cents for every dollar a patient on Medicaid receives. URMC's Peter Robinson explained this rate forces the hospital to take on more debt and unable to hire.
We are definitely losing money. The medical center this year is operating at a deficit, at a significant deficit. That's running up against the fact that we already have staff shortages, but don't have the resources now to be able to bring in the staff that we need.
With budgets unbalanced, healthcare workers describe the conditions it's made them work through the past 3 years.
Staffing shortages, overcrowded emergency departments, a very stressful environment for myself and the 1199 family.
In the Senate and Assembly House proposals, hospitals would receive a 10% increase in their Medicaid reimbursement rate, while nursing homes would get a 20% increase to get facilities more financially secure and able to hire more staff.
Every hospital, every care center, and nursing home in this state is suffering because of years of inadequate funding, which means the care given to our families and patients is also suffering.
Governor Hochul called for a 7.5% jump in the Medicaid reimbursement plan for hospitals and 6.5% for nursing homes. But those in the healthcare field argue that won't help due to rising costs of care and other cuts the industry faces.
When there's been disinvestment for a decade and a half, digging out of that hole with the added pressures of inflation and a workforce shortage, it's just inadequate.
In Governor Kathy Hochul's latest release about her plan for New York's upcoming budget, she approves of an additional $1 billion in healthcare capital funding and says her plan for Medicaid expansion will help 7.8 million low-income families. Reporting in Rochester, Alex Love, News 8.
Thank you, Alex. State Assemblyman Damon Meeks was among the state leaders at the rally today. He argues their proposals can be financed through a more progressive tax system that relies more on wealthier New York taxpayers.